Hi, this is Kerri from the future. You may notice in this upcoming video that we recorded on a different setting. If you like it, let us know. If you don't like it, let us know. Second, we did not introduce this intro in the proper sequence. So right now, you are listening to or watching episode 2 of the Hep C 101 series, and now we are going to jump back to Daryl and Kerri from the past. Today we are going to be discussing testing for hepatitis C. So Daryl, how does someone get tested for hepatitis C?
Kerri, thanks. Testing for hepatitis C. The most commonly done test is a blood test, and that's simply having blood drawn either in your doctor's office or at a lab, and most people would be familiar with that. But if you're not, it's really just a little prick of a needle, and they draw some blood out and it's sent away. In British Columbia, where we are, normally what's done outside of COVID-19 era, which is now while we're making this, the antibody test is done, and if there is a positive result, then an RNA test, a confirmatory test, is done immediately. That's called reflex testing. And I want to dig into what antibody and RNA is about. The antibody test is to test really for exposure. What that means is that you have been exposed to the virus at some time. Not everybody that is exposed will go on to have chronic hepatitis C. And when we talk about having Hep C, that's chronic hepatitis C. So the first test is an antibody test to look for antibodies that your body would have produced on its own to fight the virus. And as many as 25% of people, our own immune response it does a good enough job to actually defeat the virus, and that 25% roughly will not then go on and have chronic Hep C or have Hep C. They will not need treatment. They will always test positive for antibodies, but the antibodies, again, are something our body produces to fight. It's part of our immune response in fighting the virus. The RNA test, which is the second test, which is done if there are positive antibodies, is to confirm that there are copies of the virus in your blood. Now, if you test positive for antibodies and then you go on to have a positive test, or there are detectable copies of the virus in your blood, and that's sometimes called a viral load, then you are confirmed as having chronic hepatitis C. But it's very important to remember those two separate things because they really are quite different. Again, the antibodies are something our body produces to fight the virus. This is not unique to hepatitis C. And I should mention that they will not, as far as we know in current research, they will not offer any protection for future reinfection if a person is re-exposed after being successfully treated and cured.
Is there another way to get screened for hepatitis C that is not through a blood draw? Do we have a rapid test for hepatitis C?
Yes, there are, Kerri. Typically, it's called point-of-care testing, POCT, and simply all that means is that could happen at a local community center or organization in your community that provides services for you or others. Could be a pop-up. There have been some of those in different locations. Our organization has done some of these events. And basically, currently here in BC, or for Canada, so it's a blood test of sorts. So much like a person would use to test for blood sugar and a glucometer for diabetes, the finger is pricked, a tiny amount of blood is put onto a device, which then goes into a solution, and within 20 minutes, which is rapid, there will be a positive or negative result. But again, this is just for antibodies. There are some other new modalities or methods that are in the pipeline that show great promise, and some would include a dry blood spot. And that's something that has to be sent away to a lab to then be tested as well, but will include an RNA profile as well.
Great. Is there anything else that people should know about testing or how they can get tested for hepatitis C?
Asking your doctor if you have one is certainly a simple way. And if your doctor tries to talk you out of having a test, then you just need to be pleasant, but be insistent upon it. If you think you may have been exposed at any time in your life, clearly there are guidelines about who should be tested. But call your doctor or your local community health nurse, public health. I assume 811 here in BC would be able to steer you in the right direction, even though in this COVID era right now, as this is being made, they are not doing these tests, but they could certainly steer you in the right direction.
Well, thank you, Daryl, for sharing that information with us. And if you have further questions about testing or anything else to do with hepatitis C, you can visit our website at pacifichepc.org. And you can also give one of our friendly peer navigators, like Daryl, a call on our helpline. And Daryl, what is the number for the helpline?
1-888-411-7578. And you can text us at that number as well. And we can explain this in more detail and in fact, refer you to somewhere where you can get tested, among other things. So don't hesitate to call or text us anytime.
Thanks, everyone, for listening, and see you next time.
Thanks.